Assalamu alaikum warahmatullahi wabarakatuh. Dr. Muhammad Sani Menege is my name, a consultant otolaryngologist and a neck surgeon. We have had series of talks where we introduces the topical issue of the day, Covid-19, coronavirus disease of 2019. We've looked at the introduction, the source of disease, how the transmissibility, we look at the clinical features. Now we want to talk about Covid-19 in pediatric population, which means children. So generally from the data available compared to adult population, adult cases, there is very relatively fewer cases of Covid-19 in children. And oftentimes when it does occur, it is a milder form of the disease, and the prognosis, the outcome is much, much better. And children, because children are less frequently exposed to the main source of the infection. Traditionally, how it started in Wuhan, in Hubei province, was a seafood market, which there were very less of children involved there. And most infections in children occur. If it does occur, the recovery is within 1 to 2 weeks, and the symptoms are usually slow in onset. And so far, no deaths have been recorded. Data from China WHO expert group have shown that the few involved newborns, the transmission pathway has not been established, whether it's vertical or through contact. Then possible, why are children less predisposed to this disease? Possible reasons was, when this pandemic started as epidemic in Wuhan, the time period was during the outbreak, was during the winter vacation, where most children, either from the university or middle school or kindergarten, were actually on break and they were staying with their families. So there are very much chance for cross-contamination. Then second reason could be humoral and cellular immune development in children is not fully developed because the virus, oftentimes the fatality comes from storming syndrome of the interleukins that infiltrate the lungs, and this is less developed in children. Another reason is the immaturity of the angiotensin converting 2 receptor in children, which is a hypothesis because the virus leverage on the fact that it uses angiotensin converting enzyme receptors to attack the human body. So far, no direct evidence has been is available to prove a vertical mother-to-child transmission. 2 newborns so far have been delivered and then were tested positive, one in China and one in the United Kingdom, but still not clear whether it's a vertical transmission or as a result of contamination after delivery. Hopefully this might give good news, but of course not to also say that children should take chance. So as we protect ourselves, we should also remember to protect our children. A lot of them could be in the asymptomatic state and could be carrier and transmitted to others. Thank you very much for your time. Assalamu alaikum.